One of the things I'd like to do is to go through several of the questions that have been presented. We have about 7.5 minutes to do that. But before we get into these questions, because we have a variety of opinions among our panelists, what I'd like to do is to give them the opportunity, if they choose, to respond to any comments any other panelists made, or to expound on any points that you didn't feel that you conveyed sufficiently. If anybody wants to take that opportunity, then we'll get into these questions. So, any interest in that? Senator Hatch.
Just real quickly, I also forgot to mention Bruce Keppel was on our healthcare commission as well. And for those of you that noticed, I experienced up here a kind of age back to when I was in school, when I was taking notes feverishly when my teacher was lecturing, and my colleagues to the right, Representative Boal, was a page and a half into her notes when Kate Walton was talking, and Kate was a good page into her notes when Carmine Boal was talking. So they're getting notes on each other and on their campaigns, and I thought that was a wonderful expression of how this conference has the ability to bring out the best of it.
All right, our first question is really to everyone, and it is, do members of the panel support a public insurance option being offered through the Iowa Insurance Exchange? Any interest?
I'll start saying absolutely. It's one of the criteria that's necessary to drive down costs, in which everybody is talking about. It's a public option that will compete with the private market, which is designed to bring down costs faster. It is part of a choice that citizens would have, and the fact that it was not included in the Reform Bill was unfortunate. But it's something that if we are interested in cost containment, providing choice to our constituents, it is an opportunity we should take advantage of.
No. You know, let me just ask, I can never just stop it, no, I'm sorry. You know, the only way that's cheaper, folks, is if it's tax subsidized. So, otherwise, competition, by having several different carriers in the state, you achieve the same kind of competition. So, you know, I don't understand why that would be a beneficial aspect of competition, unless it's simply something you subsidize with taxes to drag somebody else out of business.
Well, one thing that I love about this kind of atmosphere is I'm able to talk with Linda, because we're in two different chambers of the legislature. The fact is, in this state, 71% of the insurance plans are with one company. Now, that's a monopoly. The fact that we had another option for people to look at would certainly be more competition than that company has with other carriers. So if you want to talk about the marketplace and competition, then you'd want more plans available. And if no other companies coming into this state with their private plans, then let's bring in a public plan that could be competitive, that would start driving down that cost.
I have a couple of questions here, one for Representative Upmeyer and one for Senator Hatch. This is actually a yes-no question, Representative Upmeyer, but I will allow you to also give a why. This question is, are you for or against repealing health care reform?
You seriously just want a yes or no?
The question says yes or no, but I would certainly expect you to provide context.
You know, I would not support a repeal without other things in its place. And that's the whole point of this. You can't just say, nope, that we don't want. The problem was, we didn't have the opportunity, and we haven't had the opportunity to offer other solutions that might be included. So I think there are lots of opportunities. So I guess no, if you're going to say nothing, but yes, we need to fix it.
Senator Hatch, this question is for you. It says, you show a great insight into the details, including benefits, of health care reform. The cost to the federal government was established or estimated to be approximately $1 trillion over the next 10 years. To do our part as Iowans, we need to be prepared to pay for it. Do you know approximately what the cost to Iowa is And what are the more expensive parts of this cost?
The answer, I do not know the specific cost to Iowans, but I do know if we do nothing, it will cost more. That's what we have to remember. The premiums of Blue Cross Blue Shield for this last year, in March, for small business and individual policies went from 18 to 25%. There is no estimate by any agency, including the CBO, that puts the increased cost of health care under this plan anywhere near that increased policy. The cost of doing nothing is much higher than the cost of the estimates that people are suggesting that we have here. That is really the issue that we have in front of us. To do nothing, to repeal this law and replace it with what? I don't know what the Republicans are trying to say. They've never given us an opportunity to tell us what they will replace it with, because they don't know. And some Republicans who start talking about replacing it go into the same list of categories that I put on the board. They like it. An insurance exchange promotes the kind of competition we want. Closing the donut hole is important to our seniors. Providing tax credits to businesses is a strategy they like. So what are they going to replace it with if they repeal it? It is a political question they're answering. It's not real.
Carmine, this next question is for you, and it is, what is the Branstad proposal to reduce health insurance and health care costs?
Well, I think the things that I was talking about earlier is providing more transparency, more competition. It's what Representative Upmeyer was talking about. I guess we really do feel like the current proposal is providing less competition. I think it's just a basic philosophical difference between the two parties. And it's really, this is just showing the real crux of that divide, obviously. And so at this point, we don't have any, I guess we're trying to get our arms around what the legislation is proposing. There have been a lot, and as Representative Upmeyer brought out, I think very well, is there was a lot of bipartisan work in the last few years. I know when I was in legislature, and then the last couple of years that they've done, that have done very well, that have, obviously made us one of the states with the lowest number of uninsured people in the nation. We have done a good job. And so I think continuing down that path of just figuring out how we increase that transparency is very important, that people know what they're paying for, they know what their choices are, and that we can do that without creating a public option. And so those are the kinds of solutions that the Branstad administration would work toward and work in a bipartisan fashion as well.
Please join me in thanking our panel for a very stimulating discussion. Thank you.